Changing people's behaviour is the heart of reducing demand for healthcare and also ensuring that the healthcare that's delivered is more effective. We can't afford not to go down this road. Healthcare demands are soaring at a time when healthcare resources are being seriously squeezed. And so we absolutely need to find ways in which society, organisation, workplaces, communities, environmental planning are able to take people at their heart and build in right from the beginning how to prevent the wide variety of health conditions that we know are related to behaviour.
This whole journey of integrating social science into the work that we're doing and improving the people's health, the health of people and population, is really, really important. And the importance lies in our understanding of what drives health today. We know that health and well-being is not simply having access to good healthcare, but there are a range of other determinants and factors which influence it, including our genetic makeup, the behaviors, and the context which drive those behaviors, the environments that we're working in and how those interact with us and our behaviors as well. So if we truly understand this wider determinant of what drives health in a population, it means that social and behavioral sciences have got to be part of the solution as well.
It's one thing to change behaviour in the short term, but to get the health benefits, this needs to be maintained over time. The factors that are necessary to maintain behaviour are often quite different than those that are needed to bring about short-term behaviour. And social sciences are able to understand those kinds of factors, are able to understand the complexity of the multifactorial causes and maintainers of ill health and the kinds of interventions that are most likely to be effective.
Social and behavioural sciences have a range of tools and ideas and findings which go way beyond common sense when it comes to helping people to develop interventions and understand the problems. So when people try and think about how they're going to develop interventions to improve health and well-being, the natural thing to do is to assume that you could use common sense and it'll all work out. And we have a litany of hundreds of millions of pounds worth of wasted resources which demonstrate the fallacy of that approach.
There isn't one of the major healthcare conditions that isn't related to human behaviour. But in order to successfully prevent ill health, it's absolutely essential to intervene not just at an individual level, but at many levels: population, community, workplace, and individual. Do that simultaneously and consistently.
The reality is that thanks to social and behavioural sciences, we now have actually quite good ideas about how you can change behaviour at population or individual levels. The big challenge very often is how you implement those changes and how you implement the interventions. And so one of the things we need to do is to treat the implementation as a behaviour change problem and not assume that if we just tell people that this will work, or we educate people, or we provide guidelines, then the health professionals, the policy makers and so on will somehow automatically recognise the merits of what we're saying and go on and do it.
So I think networks are really going to be important moving forward, and thinking about how we bring practitioners, policymakers, academics, business and members of the public together to talk about what are our research priorities, how research monies are used and invested, and how they influence programs must be key to our work moving forward. The good news is that there are examples where these networks are being created. The challenge that we've had is that often these networks are not funded, they're not sustainable, and we don't extract the best lessons from those networks to help us to develop others.
There is obviously a lot of researchers working in the behavioural sciences and social sciences, and how potentially can we better link those to local government or the voluntary sector or policymakers, so that what is being delivered and the design, we were talking earlier about the design and of these services and interventions, are better designed and better structured. For example, we do training for local public health teams on behavioural insights. There's been incredible demand for that at the local level. That's how we can start to raise an awareness of some of the issues and some of the tools and resources that can be applied.
One of the big challenges we have is how do we take what we know is working at the national level and how do we make it real for partners working locally, and how do we create and recreate some of those effective networks or approaches at the local level. I think there are three key things that we really are focused on in Public Health England. I think there are key lessons to be learned for others. The first is really investing in dissemination, so being absolutely clear that the research process is not finished until there is effective dissemination, and that those who need to know about the information or the program are aware. Second, that we invest in that process of transfer of evidence into action. We invest appropriately, and we don't think or believe that the implementation side will almost take care of itself. I think we now have enough examples where we know that actually without the planning, without the funding, without the leadership and without the resources to support good implementation, it doesn't happen. So if we're thinking about moving from national to local, we need to invest as well. And then finally, the third key point is again looking at where we have models of best and promising practice. Some great work is being done in tobacco control, fantastic work being done in tackling obesity. We have great lessons from the response to the HIV epidemic and how we can mobilize national partnerships and programs and do and replicate that locally. We need to be building on those examples moving forward.
So how do you pull those two strands together? I think one way to do it, and this is something that we may be able to bring out in the report, is to set national standards and have a national model and a national set of aspirations and goals, but to have it so that where there is the opportunity for local variation, where local variation really matters, in terms of the cultural makeup of the community, the levels of social deprivation and so on in the community, that it is sufficiently flexible to accommodate that in a way that is driven by evidence. So what we want to do is to substitute a postcode lottery in which it's just luck as to whether you get a good standard of service or not, with I don't know quite what the equivalent would be, but let's take the lottery out of the postcode lottery.
This report is needed now for so many reasons. On the one hand, it's about raising the profile of the contributions of social sciences and behavioural sciences. Yet on the other hand, is ensuring that we have a much more structured and a strategic approach to implementing that learning, so that we're truly, in 5 or 10 years' time, we can look back to say, as a result of this, we have made real inroads in the integration of social and behavioural sciences in our work. And then finally, I think the report will have a key role to play in ensuring that we all are speaking from the same script, that we have the same understanding and definitions of concepts and the same paradigms within which we're working. And for practitioners, it's really important to understand how they can make sense of it and how we have a common language and narrative for the work. So I'm hoping that the report itself will be instrumental in helping this shift and providing a roadmap for what we need to do in the months and years ahead.